First, a little background on bacterial meningitis so that you'll understand the medical factors important to us in selecting the right paper. Bacterial meningitis is an infection of the meninges of the brain. The meninges are the membranes that surround the brain. When a patient has bacterial meningitis, they act like Kristen. They are often sleepy, sometimes irritable, and have nausea and vomiting and complain of headache. On physical exam, the patient usually demonstrates something we call nuchal rigidity. The nuchal rigidity is just a fancy word for meaning a stiff neck. The patient has a stiff neck because the meninges, the same membranes that surround the brain, also surround the spinal cord, and they are also inflamed from the infection. Bacterial meningitis is actually a medical emergency. The consequences of untreated or improperly treated bacterial meningitis range from hearing impairment due to damage of the nerve for hearing all the way to death from cerebral swelling. Because the consequences of bacterial meningitis can be so severe, it is extremely important to diagnose and treat this disease as early as possible. A definitive diagnosis of bacterial meningitis can be made when the patient's spinal fluid grows bacteria in a culture in the lab. This is known as a positive spinal fluid culture. The problem with using this as the sole diagnostic criterion is twofold. One, it often takes approximately sometimes 3 days to come back positive. And two, patients can actually have bacterial meningitis but not ever have a positive culture. This can occur for one of two reasons. Either the cause of the meningitis is a virus, not a bacteria, or that the meningitis is what we call partially treated meningitis. This is what we think is happening with Kristen. She was treated with antibiotics, which were prescribed and given to her orally for her strep throat, and these antibiotics may actually kill some of the bacteria in her spinal fluid so that it doesn't grow a culture in the lab. Fortunately, we have other parameters of spinal fluid that help us to predict whether or not a patient has bacterial meningitis. These parameters include the white blood cell count in the spinal fluid, the protein concentration in the spinal fluid, and the glucose concentration. In classic bacterial meningitis, a patient will have a high white blood cell count, a relatively high protein concentration, and a low glucose concentration. Now, if you recall when we discussed Kristen's lab results, she had a relatively low white blood cell count, so that doesn't exactly fit, but she did have a high protein concentration, and then again the glucose concentration was sort of in the middle, so that's not really going to help us. But what we need to look at is an evidence-based medicine question about whether or not a high protein concentration can in some way help us predict bacterial meningitis.